All right, welcome everyone. We're going to get started with our webinar today, Expanded Panel Genetic Testing and How to Select Your Donor. Let me introduce you to the folks who are going to be presenting today. I'm Suzanne Seitz. I am the Certified Genetic Counselor with Fairfax Cryobank. I've been here for over 15 years doing the sperm bank, but have been with the parent company, Genetics and IVF Institute, for almost 30 years, and have been working with prenatal, pediatric, and now most recently with the donor sperm bank. And Christy Burke, who is our co-director of client services, will be available during the Q&A session at the end to answer questions about how to order and ship files. And then our moderator, Morgan Barker, is here with me to help with the moderation and to keep this running smoothly. I wanted to introduce you to our genetics team. I'm very blessed to have a very strong professional staff that I work with who can provide additional insight, research, knowledge to any of the complex questions that we have. Dr. Harvey Stern is our medical director. He is an MD PhD, so his MD is in pediatrics, and his PhD is in molecular genetics, and in addition, he is a clinical geneticist, which required many additional years of training. He has been our medical director for over a decade, 15 plus years now, and he is an amazing resource, not only for donor screening and family history assessment, but any unique genetic testing questions, and really keeping the program on track to stay at the forefront of genetic testing and screening. Michelle Oddie is our director of operations. She also has a PhD in genetics, and she oversees the entire donor production, just that whole network of recruiting the donors, bringing them into the laboratory, getting them screened, and getting them ready for clients like you to see. Dr. Brian Mariani has a PhD in molecular genetics, and he runs our molecular infectious disease laboratory, who does a lot of the genetic testing on the semen vials themselves, screening for infectious disease by using genetic testing or DNA testing, and he is a wonderful resource for us as well. We're very happy to have a genetic testing laboratory on site. And then, of course, our founder, Joseph Schulman, he is not only an OBGYN, but also a clinical geneticist who had a career at the NIH before he founded the Genetics and IVF Institute. And he has certainly been the one who's directed all the priorities, very much focused on genetics since our inception. So the goals of the webinar, we're going to spend the first 30 minutes doing the webinar, and then we'll have a 30-minute Q&A session at the end. If you have questions, go ahead and type them into your panel on the side, and we will have Morgan moderate those in the last 30 minutes. So as the questions come up during the presentation, just go ahead and put those questions in. At the end of this, I really want you all to understand what it means to be a carrier. I want to explain how the genetic testing is done on Fairfax Cryobank donors. And I want to show you how to use our unique donor search to actually find donors that are suitable for you from a genetics perspective. And then, of course, answer your questions. We usually have a pretty robust Q&A session at the end, so don't hesitate to ask your questions. So the first thing I wanted to do was a poll. The question is, how familiar are you with expanded genetic carrier testing? So you have three options: very familiar, I'm a pro; medium understanding, or I'm beginner, still learning. Let me know. Go ahead and click one of those buttons, and then we'll get a sense of how many beginners we've got and how many people really have figured it out. So right now, we have very few that feel comfortable with this, very familiar, about 4%. Medium understanding is about 28%, and it looks like 68% of you are telling us that you're beginners. So that's great, because the presentation is really trying to focus on just making sure that you understand the basics here. So expanded genetic carrier testing started on donors in January of 2018. So for the last 2+ years, we've been doing this genetic screening for more than 283 conditions on the donors. And that's important because the donors prior to 2018 also had genetic testing done, but they had fewer diseases tested. But that will give you a sense of the recent changes that we've made in our genetic testing panel. The advantage of doing the testing in this expanded format is that it uses gene sequencing, which offers the highest detection rate possible for variants within those genes. So we want the best test available that reduces the risk as the most that we can. So what we're testing for are these autosomal recessive diseases. So you guys may remember this from biology class, but basically what we're trying to avoid is having two carrier parents have an affected child. That happens when each healthy carrier, I mean, these are typically people that show no symptoms of the disease. They carry one variant. Their other variant is normal, but they carry one variant that isn't normal. And if two people partner, 25% of the time they'll have a child that will have two normal. 50% of the time they'll have one with the normal gene and one with the variant. And then 25% of the time, both variants in the child, which means the child is affected with the disease. So that's the situation we're trying to avoid. And when we do an expanded panel test, we're going to find, at least at the 283 level, about 70% of the time, we're going to be carrier for at least one condition on that panel. And that should not be a surprise. You know, ultimately, we're all considered carriers. This group of 283 diseases is a small subset of all the possible genes that could contribute to disease. And we're going to find out that we're a carrier. The chance that both biological parents are carriers for the same gene is exceptionally small. That's going to be less than 1%. That's the situation we're trying to avoid, you know, that two carrier parent situation. And when we know that we're both carriers for the same condition, it's a 25% risk. That is the number we want not to happen for our children. So our goal through this testing and through you looking for donors who are tested is to reduce risk. And if you are a carrier for a specific gene, you know this because you've had genetic screening done already, you want to find a donor that's already tested negative. And in reverse, if a donor is a carrier for a specific gene, we want to make sure you're tested negative before you move forward with that donor. That's basically the starting place. So if you're a carrier, let's say you've had your genetic screening done and you know that you're a carrier, you are obviously in good company. Many of us are going to be carriers if we have this kind of testing done. Now you need to look at donors who have already been tested negative for that condition. And I'm going to go through a step-by-step instruction on how you can do that within our donor search. We do have that capability of trying to find that good match for you directly through the search. And ideally, if you're going to start looking for donor sperm and you know you're going to have carrier testing done at some point in the future, get those results and it will make this process so much simpler for you. If you've already had your results, if you have your results in hand, that will make this actually go very quickly. If you still have carrier testing to do, that's going to slow things up a bit. So let's assume you have not had an expanded panel, and therefore you don't know that you're a carrier, but there's no red flags. At this point, what are your options? Well, you can look at donors who are not carriers first, and we have over 200 donors on the site that who are not known carriers. So that is a good group of donors for you to look at. But if you like a donor, if you've been looking through the donor search and you ultimately land on a donor that is a carrier, and we have several donors obviously who are carriers because they've had this expanded panel done, you have the option then to go get tested specifically for that gene, or then maybe pursue expanded panel testing yourself to see if you're a good match. That will slow things up by several weeks for you. Now in the time of COVID, it's not as easy to go in for a blood test, but it is possible for many of these labs now to send kits directly to your home and collect a saliva sample at home and ship it back to the laboratory. So that is an option now for expanded panel testing. That's typically in the U.S. Some of the international clients are having, it's a little bit more of a challenge, but certainly investigate that option if you are interested in a carrier donor and have not had carrier screening done yourself yet. So let's take a look at what a donor looks like on his profile page. If you want an expanded panel donor, you're going to see this little added bonus banner at the top of his donor page. It says added bonus, this donor has had expanded genetic testing done. And there's a link there that you can go to that pretty much summarizes what we're talking about in the webinar here about what is expanded panel testing. And that gives you more information. But you will see that at the top of every donor page when they have had the expanded panel testing. If he has not had the expanded panel testing, that banner will not be there. And you're going to see the donor's genetic testing is actually available as a downloadable PDF on every donor page, on every donor. So you're going to click that and you're going to be able to see a summary of the genetic testing that he's had done. So that's always a good place to go for a donor that you're really interested in, because typically your doctor or your clinic will want to see that information so that they can help determine if this is a good match for you. And I'm going to go over what one of those typical downloads looks like. So when you see a genetic testing summary, which is that downloaded PDF, you're going to see several boxes of tests that they've had done in column 1, and then you're going to see the result in the middle column and any kind of description on the right here that will give you more information about risk that's left over after a donor is tested negative. I'm going to go through each one of these lines with you so that you understand. The first thing that all donors have had done is a chromosome analysis or a karyotype. They are looking for that magical 46 chromosome number. We're going to find one X and one Y, which determines gender. And we're going to make sure that there aren't any rearrangements or variations within that could predispose to risks in their offspring or their children. So every donor has had a normal chromosome analysis as part of his screening process. He cannot move past step 1 if this chromosome analysis is not normal. So that's always a good starting place. In addition, every donor has had a hemoglobin evaluation done. Now, this isn't a DNA test, it's a blood test that's looking for specific markers on those blood cells. And this is a test that's been available for decades. And it's a very simple screening tool to identify donors who are carriers for sickle cell disease, beta thalassemia, and some of the donors who are alpha thalassemia carriers. But that's a standard done across all donors, regardless of whether they've had the expanded panel done or not. Then you're going to get into the section about the specific genetic conditions that were tested, and you will see an attached report that has all the condition names. Sometimes these reports are over 10 pages long, but that's a really good place for you to see what he is a carrier for. It's going to be on that front page as well, bolded in red so you can see the name, but it's also going to be attached as a result that you can share with your clinic. Now I wanted to talk to you about how to use our donor search tool to actually find these donors and find these matches that are going to work for you. When you go to the donor search page, you'll see several different tabs. You know, the basic search, the advanced search are ways for you to pick characteristics of the donor that you like. But now we have this genetic testing search tab that you can use to find donors that match the kind of genetic results that you need. If you open that genetic testing search tab, if the any is clicked, that's the default. That means the donor with any genetic testing, expanded or not, will be presented. So all the donors on the search will be there. If you are interested in only seeing the donors that have had the expanded genetic disease testing done, then you can click that box, the box here in the middle, that will only show you the donors with expanded panel results. Keep in mind that 70% of them will be carriers for a genetic condition, but they've also had that expanded panel done. Then you can check the donors that are negative, all negative, and that will be a pretty small subset of that larger group. Right now we have about 20 donors on the search with available vials that are all negative. They tend to be purchased relatively quickly. It is a good option for someone who has not had any expanded panel testing done themselves, because now we know one side of the equation, the donor is all negative for everything tested. So even if you were a carrier for one of those other conditions, it would still be considered a good match, because we're talking about autosomal recessive diseases from that original graphic that I showed you. It only matters if you're both carriers for the same condition. If one of you's already tested negative, even as a carrier on the other side, it's going to work for you. So you do have the option to go further into this genetic testing search. You can actually select donors that have already tested negative. So if you know you're a carrier for a specific condition, you can sort the donor list by donors already tested negative, by condition name, or by the gene name. And the gene name is typically in parentheses after the condition name. So for instance, Tay-Sachs disease, the gene is HEXA. For cystic fibrosis, it's CFTR. You have the ability to sort by either method. I prefer to use the gene name, and the reason I say that is because across different genetic testing panels, people will actually call conditions different names, even though they are the same gene. They're basically all the same thing, but the gene name is the common denominator. So I really like using the gene name as the way to sort those lists more carefully. And this is a good example of why I like to use the gene name instead of the condition name. For instance, the HBB gene will actually indicate if you're a carrier for sickle cell or a carrier for beta thalassemia. So if you just put in sickle cell, you might not get as conclusive a list as if you put in the HBB gene. So in that case, you would certainly want to use HBB for your sort criteria. So this is what those panels look like when you open them up. There are lots of very long, complicated names in there. If you can't find the condition name, look at that gene name and see if you can find it on the gene list. But let's say it's an easy one like biotinidase deficiency here. You would click that box and hit apply at the end of the list. You can do the same thing for a gene name. You can click the box. They're all alphabetized, or you can use the search feature if you'd like. Hit apply. And now you have the ability to go one step further. You can take donors that are negative for the condition you're a carrier for, but now you can actually sort them for ancestry or education or any of the other things that you see on the other tabs that you like. And that would bring that list down to at least a group of donors that are going to be appealing to you on things other than genetics. So now you've found a donor that is tested negative for something you're a carrier for, but there's a good chance that that donor will possibly be a carrier for something else because he's had the expanded panel done. You may be positive for disease 7, but now he may be positive for disease 10. So then we have to take the next step, which is we have to make sure that you've tested negative for any condition he's a carrier for. If you haven't been tested, that's a stop. You actually can keep looking, or you can go ahead and pursue additional genetic testing yourself. If this is the guy for you, then you have the option to go and get your own genetic testing done so that you are negative, and then you can move forward with that donor. Let's say that you're a carrier and you've looked through the list. There isn't anyone on the expanded panel list that really works for you, but you found somebody that you really like, but he hasn't been tested yet. There are options to get additional genetic testing done on the donor that you like. It's going to add some time. You also need to check with us to make sure that the test can be done. 9 times out of 10 it can. There's going to be an added time frame of 3 to 4 weeks to get a result, possibly longer in some cases. and there is a fee. You also, before you start this testing process, we want you to own vials, because that 3 or 4 or 5 weeks may make a difference in the donor availability, and we don't want that donor to sell out while you're waiting for those results. They're likely going to be negative, and now if you have a negative result and no vials, you have to wait. So we really want you to own vials before you start this genetic testing process with us. Now, if we go back to the donor search and to an individual donor card or an individual donor page, you're going to see all these downloadable products. And this is the way you know a donor is a carrier. Underneath this genetic testing download, you're going to see something called an acknowledgement of genetic risk. That tells us that we have something we want to share with you. You need to acknowledge that you have read it and understand that there's added risk here potentially. And we want you to be able to sign this online as a DocuSign before you move forward with the purchase of this donor. And let me show you what an acknowledgement of genetic risk looks like. So at the top, it has the donor number, and then it's going to give you the information about what specifically he's a carrier for. It's going to give the condition name and the gene name, and it's going to request that you, it's a one-page document. It's not terribly long. You're going to ask you to discuss this with your healthcare provider. It's going to ask you to acknowledge that if you are both carriers for the same condition, now we have that increased risk situation we're trying to avoid. So just to acknowledge that we don't want you to use the donor if you're both carriers. And if you do need to get genetic testing done or to get genetic counseling, now's the time to do it. You do have the option to go ahead and purchase a donor even if all the genetic testing questions haven't been resolved, because donor availability can fluctuate day to day. If you found a donor you like, you can go ahead and purchase those vials, keep them on site with Fairfax Cryobank, and then you have the option for a full refund within 45 days to allow you time to get your counseling and your testing done. Typically, a test, once the lab has your sample, it's going to take about 2 weeks. So we're hoping that that's enough time for you to kind of work through any logistics that you need to resolve any testing that needs to be done. And obviously, if you turn out to be a carrier for the same thing that the donor is, we clearly don't want you to use that donor, and you have the full option for a refund or a vial exchange. So the bottom line here is you found a donor that you want. How do we get to a place where you can be ready to go? First of all, if you're a carrier, the donor has been tested negative for the same gene or condition. That's good. But if the donor is also a carrier, we have to make sure you have been tested and are negative as well. That's good. That's a good green check mark, ready to go. And if both you and the donor are not known carriers, so let's say you had testing several years ago, no known carrier status, the donor was tested before January 2018, he's not a known carrier, that is still considered a suitable match because neither of you are known carriers. So you found the donor you want. Here are the steps that you can take to actually move that process forward. If you're a new client and you've never purchased from us before, it's always easier to do this process on the phone. But before that first vial goes into your account, you need to complete a terms of use. You can find that on our website under the resource tab. It's a link. It can all be done online. And then once you've completed that, it gets sent by email to us, and then we load that into your account and we have you established as someone who's ready to go to the next step. If the donor is a carrier, we do need you to complete that acknowledgement of genetic risk form as well. So those two documents together will be required before you can place your order. And then since this can get a little complicated, and we want to make sure we know where the vials need to go, what vial type you may need, we can help work through some of those issues with your clinic. Doing that over the phone can be incredibly helpful. If you've been with us before and now you're back for perhaps a different donor, or you just want to repurchase the same donor, you can go right into the online ordering, and the entire process can be done there. Your terms of use has already been in there. If there's a new donor with an acknowledgement of risk form, you can do all of that through the online ordering process. So just to summarize, we've got, it's important to know that all of us are genetic carriers. So being a genetic carrier is completely normal. We're going to stay healthy. We must be sure, though, that a partner that we use is negative for the same gene that we carry. That is the way we're going to reduce the risk for our children. We can use the donor search to find a donor that's suitable, genetically suitable. By knowing our genetic results, we can search for a donor that's already tested negative for something that we are a carrier for. And once we find the ideal donor, we know how to take the steps to complete the order. I know that there are often very complex issues where it's hard for you yourself to sit down at your desk and look at these results and really know what you're looking for. It can get quite complicated. These reports are really quite long, and I'm available as a resource as well. You can reach out to client services through the 800 number. If you have a digital copy of your genetic testing results and you have some donors in mind that you really like, I can really do a quick assessment and let you know if it's a good match and move you forward through that process more quickly. And I'm also available, to answer questions about specific donors that you might like as they complement your genetic testing results. So when we obviously had a quick 25, 30-minute webinar here, let's go ahead and ask the poll again. How familiar are you with expanded genetic carrier testing now? Well, this is awesome. So I guess this has worked well for us. In 25 minutes, we've moved people from, we don't have, very few people still consider themselves beginners. We've now had 56% with medium understanding, and 42% now feel that they have a very, very good understanding. So hooray for you all. I did want to let you know that there is a promotion that's going on for anyone who's attended the webinar. If you're still looking for a donor and you're looking for a way to view all the donor information without having to pay for each item that you download, I mean, there's obviously a large amount that's free. Those genetic testing summaries are always free. The medical profiles are always free. But there are some additional donor products like the full audio interviews or silhouettes or photographs that do cost individually quite a bit if you buy several of them. But we have these unlimited access packages that allow you to view a lot of that information for one price, or all that information on the donors for one price. So you can use that at the checkout when you are in your online account. Put that promo code in, Genetics Webinar 2021, and it'll automatically give you the $149 discount for the unlimited access plan. So now we're going to open it up for questions and answers. Hopefully you guys have been putting in questions.
Yeah, we already have some great questions coming in. As a reminder, go ahead and put them into the webinar sidebar, the questions panel, if you have questions yourself. So let's just dive on in here. The first one says, before picking a donor, do I need to have a genetic screening done?
You know, you can do your genetic screening at any point, but if you've had it done before you start looking for a donor, you will be able to get to a donor, to a purchase, to a shipment, and to your cycle a lot faster. So ideally, I prefer that you know your genetic testing status before you start looking for a gamete donor or a sperm donor. It just really does allow you to know exactly what you're looking for. And should you be someone who happens to be all negative on one of these large panels, that's going to put anyone available to you. And so that is really helpful for you to know how big or small your circle needs to be when you look for a specific donor.
The next question is, how do I know what is a genetic disease versus a regular disease? For example, if we have family with a few cases of cancer and diabetes, heart diseases, and asthma?
Well, I will say the genetic testing search is very much limited to these autosomal recessive genetic diseases that have genetic markers, genetic variants known. So we are just testing for that small group, 283 genetic diseases. If you have a family history of inherited disease, but it's not something per se that has a genetic test that's positive that you can track through the family, it's not going to be helpful for you to use the genetic testing search for that. But the medical profiles on the donors are pretty detailed all the way through the grandparents, and it will show you family histories of things like cancer, diabetes, heart disease. And if you have a family history that's weighted heavily for one type of disease, and it seems to be going generation to generation in your family, and you might be at increased risk, it's good to complement that with a donor that doesn't have those issues. So just so that there isn't that genetic load from both sides of the family. Those aren't diseases we can readily test for at this point. Maybe in a decade or so, there'll be testing available that will let us do genetic matching on those genes as well, but today that's just not possible.
The next question here says, I have bipolar disorder 1, yet if my donor child gets diagnosed as bipolar later on in life, do I report this diagnosis still, even if my donor child could have gotten this diagnosis from me and not the actual donor itself?
Well, I mean, I do talk to families that are reporting medical issues in their children, and it is important, regardless of your own family history, to just let us know what's going on. The reason I say that is because I want to be able to compare it to the health of the other children that are reported from that donor. Your family history does matter. So, there is that small increased risk that your child would inherit bipolar from you, and that is going to be part of that information. Had you not had a history of bipolar and your child has bipolar, then now that, the equation changes a little bit, because now potentially the donor may be contributing some genetic information. There's no genetic testing for bipolar at this point, but it is still important. Anytime there's a medical issue in a child, a newborn, a 5-year-old, we would like to hear about it so that we can keep track, and certainly if there's an increased risk to the other children, notify other families that have used that donor, because we want to be as transparent as possible. We do also put information about any medical updates that we receive into the summary profile for each donor. So, for instance, if there's a donor that has had a medical issue reported in an offspring or a child, I'm going to be putting that into the summary profile update section. That is the one part of the donor profile that will be updated every time the donor gives us information, anytime a child is reported with a medical issue, and that it will always be accessible to you even well after the donor has sold out, 10, 20, 30 years from now, because we know people want that updated information about what's happening in the donor's medical history, his family history, or any children that may have been reported with medical issues. So that's where we communicate with you and keep you updated.
We got a couple of questions regarding people who have decided not to be tested themselves. Is it safe for them to pick a donor who has tested negative for everything?
So, if you have not been tested and you don't know your carrier status, if you pick a donor that's had an expanded panel that's all negative, that is plan A. I mean, that is the best option because we know he's negative for 283. Even if you're a carrier, it's not going to increase the risk for an affected child because only one of you would be a carrier. So that's important. That's the important bottom line. But often, if you are looking at donors that have not had the expanded panel testing done, now they have had limited testing, you have had no testing, so that means that we have some unknowns, but we don't know the status of either of you on many, many genes. that is still an acceptable situation because neither of you are known carriers, but it doesn't require you to have any additional genetic testing. But if you choose a donor who's a carrier, and there are over 100 of them on our website right now, if you choose a donor who's a carrier and you have not had genetic testing done, that's a stop. That's a discussion with your physician, and you need to make a conscious choice as to whether or not you will be tested for that specific condition. If you choose not to test, even though the donor is a carrier, it's important to understand the underlying risks for an affected child. It would be slightly greater, and you can make your decisions perhaps based on risk, perhaps based on the specific disease and how serious it is. But I would not ship vials on a donor that's a carrier unless you've addressed those questions with your doctor and made a decision to test or not to test. We've had clients who've shipped vials on carrier donors and then realized that those questions weren't answered, and it gets complicated because we certainly don't want you to ship those vials until you have the answer to your carrier status question.
The next question here is a couple parts to it. Can you discuss if the blood type matters, and can you discuss CMV status? Also, what is important to look at for family history? And then how often do you update the summary? The donor has been active since 2019, but no updates on his status. So blood type, CMV, family history.
Summary profile. Okay. So on blood type, you know, if you are Rh negative, if you're A negative, B negative, O negative, AB negative, you will get a recommendation from your physician to consider using a negative donor. But it depends. If that's a discussion to have with your physician. But if you are negative, usually the standard recommendation is for you to look for negative donors. And the reason for that is that you could develop an immune response to an ongoing pregnancy if you use a positive donor, have a positive fetus growing inside of you. Your body could see that as an intrusion and cause an immune response that could make the baby very sick. So to avoid that situation, if you are Rh negative, discuss those options of donor selection with your doctor before you make a final choice on a donor. If you are blood type positive, any donor will work for you. And the majority of people are Rh positive, ABO, AB positive. So any donor would work for you. Now, if we talk about CMV status, if you are CMV negative, which means you've never been exposed to the cytomegalovirus, you've never developed antibodies. So the goal is not to have you have an active infection during a pregnancy that could complicate a pregnancy and make a baby sick or even make a newborn sick. So we really want to avoid any situation where you put yourself in a place where you could be infected. Now, our donor sperm are screened. The actual sperm is screened by CMV DNA. So we know in very specific intervals what that donor's CMV status is by testing his semen. If he is CMV positive before he started the program, meaning he had a CMV infection a ways back, has a positive antibody, he will be CMV positive, but his results will show us if he's infectious or not. He will not be allowed to distribute vials if he is infectious. So there are two parts to the CMV question. Has he developed antibodies, making him CMV positive, and is he infectious? If he's infectious, he's been excluded. His vials are excluded. So if you are CMV positive, you can use any donor on our website. Any donor is fine, CMV positive or negative. If you are negative, your doctor may suggest that you only use a CMV negative donor just to be safe. Many doctors will still allow you to use a CMV positive donor because we feel very confident that our donors are not infectious. Even if they're CMV positive, that's a past antibody response that does not dictate being infectious. But doctors will often make policies about your ability to choose a CMV positive or negative donor based on your CMV negative status. The majority of people in this country are CMV positive. The majority of our donors are CMV positive as a result. If you are CMV negative, that is something to discuss with your physician. It depends on what kind of procedure you're having done. If you're doing IVF, the risk is obviously much less because that semen is never touching you. If you are having an insemination, the doctors may have specific policies on your ability to use CMV donors. Now, what was the third thing?
The updates.
The updates. So our updates, our donors receive family history. How often do we?
Should they be looking at that and considering that as well?
Well, when you know your own family history, it is important to review the family history of the donors. Now, we do that here. Our medical director, Dr. Harvey Stern, is, he's the one who does a thorough review of that family history before that donor is even allowed and accepted into the program. So any situation in a medical history for a donor that tells us that his children are at increased risk above the general population risk for a condition is going to be excluded. A clustering of certain diseases on his side of the family. We've already done that assessment, and based on what he's reported to us as his medical history in his family, we've already made the assessment that we don't see an increased risk for his offspring. Now, a donor's medical history and his family history is going to change over time, and that's why every year they are receiving requests for updates. They do this online. It doesn't take them very long. And when we get a response from them, that is put into the update box. We tell you the month and the year it was received, and we give you an update. Now, it could be an update about finishing a graduate degree or changing his occupation, but it could also be information about his own medical history that changes over time, or information about his relatives, his parents, his siblings, his grandparents. If a grandparent has passed away, we get information about the age and the reason. So we try and be encouraging of them to provide that information on a routine basis. So I would say a good percentage of our donors are doing that annually. They're in the system. If a donor is still actively in the program producing bios for us, then he hasn't started that annual update process yet. So some of the newer donors are still active with us, and if there is an update while they're with us in the program, we'll put it in there, but they haven't started that annual cycle of getting back to us. And that information is also reviewed as it comes in. So if there's a medical situation in his health or in his children or his relatives that's of concern, that could cause us to then aggressively notify anyone. But if it's just an update that isn't expected to increase risk, we'll put that into the summary profile.
We're getting a couple of questions about pricing and how much the genetic testing costs, and then also how people can go about getting their own testing done.
So, if you have health insurance that covers carrier screening, that's probably the best way to work this out through your doctor's office. They have to order the test for you. It has to be ordered by a medical provider, and those results come back to your medical provider. They offer genetic counseling, typically at no additional cost if there is a result that you would like explained to you. And your doctor's office will have set up relationships with different screening labs. Examples would be Semaphore, which is the one we use, Invitae, Myriad, Horizon. Those are standard expanded panel genetic testing services that are available. If you have insurance, then the copays tend to be very, very small. So really the best way to get your own genetic testing done is to work through your doctor's office to get that done. And it could be just your OBGYN who's doing your annual visits with you. It doesn't need to be a specialized provider because he or she is managing anyone who's planning a pregnancy. And it's best to get that done before you become pregnant, because once you're pregnant and you start getting information, you have to act on it can get very, very anxious for you until you have your answers.
A follow-up to that question, someone wants to know if 23andMe, if we would take those results.
You know, 23andMe is, has a different focus than providing these diagnostic diseases that we do for the 283. I mean, I'm hesitating because there's so much other information that 23andMe provides that isn't applicable here. But if you find out that you're a carrier, for instance, for cystic fibrosis, clearly that is real, and you would need to address that in choosing the right donor for you. But their panels tend to be much smaller, and it's important for you to get a digital copy of your result. So anybody like myself, for instance, can make sure that I'm matching it to the right donor, or any genetic counselor through your doctor's office. But you tend to get tested for a lot fewer diseases. These are the autosomal recessive serious pediatric diseases. They can give you lots of information about, you know, drug sensitivity and ancestry, and those aren't necessarily helpful in this situation in choosing a sperm donor.
Some people are asking about donor screening. Do you do the criminal checks and background checks on donors, and what about psych testing?
So every donor has had a criminal background check. That is a very important part of our screening process. In addition, about 4 years ago, we started doing the psychological assessments on each of the donors that were starting in the program. We use the PAI, which is the Psychological Assessment Inventory. It is scored by a PhD psychologist who is very adept at doing that particular assessment, and we do screen out donors that do not pass that. That's looking for psychopathology, things like bipolar or schizophrenia or depression. So it's looking for things that are known to increase risks in offspring, even if it's slightly increased risk, are known to show increased risk. So we do have donors that have had that assessment done. They do have to pass it in order to stay in the program.
Christy, I've got a question for you now. How many vials is it recommended that people order?
That's a great question. It will vary. It's something we will want you to discuss with your physician before placing an order. But on average, I would say most of our clients are purchasing between 1 and 2 vials per procedure.
And Christy, another one for you. What if we want to have children and would like them to have the same biological father? Are we able to buy extra vials and keep them in our freezer until we are ready to have a second child?
Yes, definitely. We would highly recommend, if you have the means to do that you do that. You can purchase and place an order for as many vials as you wish up front at the time that you place your order. You can store them here with us as long as needed. And what's great about storing with us is if they never leave our facility, if you never end up shipping out those vials, you would always have the opportunity to return them back to us for 50% of the original purchase price. And there's no time frame on that. So it could be, 10 years later and you could still get that refund. I do talk to clients all the time, unfortunately, who don't do that for whatever reason, and then they come back to us a few years later, and unfortunately we might not have the vials anymore, and that's really hard. So if you're able to do it, yes, we would always recommend that you purchase and store up front with us.
Great. All right, another person for Suzanne wants to know, in terms of overseas carriers, is the expanded genetic testing results the same?
So, we work with several clinics abroad, and you all will have different testing available to you. Some of them have more than 283, some of them have less. It depends on what your physician has access to. So it is different, and sometimes, the names of the conditions are in a different language, so that's why that gene name becomes really critical, because that's a way for us to see exactly, compare apples to apples. It is often different. I do know that Semaphore does do some international screening, but not all the labs that are available in the United States actually have the ability to test clients abroad. Now, the advantage is that they can do this testing on saliva, so it can be easily shipped. So it may be that your clinic may be able to set up testing just for you or for you and a few other clients, and contact the labs and have it done. Even if you're the first one to request it, it's usually not too difficult to get it set up.
Great. 1 second. Suzanne, what is the best resource to get information on the conditions being tested for and to find out what the ramifications of having the condition are?
You know, the nice thing about the genetic testing summaries that are posted online, if you go to that donor that you like, you download his genetic testing summary and you find out that he's a carrier for something, on page 2 or 3 of that genetic testing report, you'll actually see a really nice discussion about what that condition is and what the children, what the physical features of that condition are. So for that condition that someone is a carrier for, there is going to be a nice presentation. I would recommend going to the Semaphore. Actually, we have it on our website. We have a link to the Semaphore section that talks about each of the diseases that they test for. But on your report, let's say you have a genetic testing report and you find out that you're a carrier, there should also be a very nice summary that describes that condition for you. And I do recommend taking advantage of the complimentary genetic counseling that these testing facilities, these testing companies offer when you get a result, because that's one of the things they do, is they explain the condition, they can explain the risk of a partner being positive, and many times if you have a very rare disease that you're a carrier for, the chance that a partner would be a carrier might be much less than 1%. So you might have a different way of thinking than if it's a 4 or 5% chance that your partner might be positive. Depends on the disease, and then the disease itself can, we have mild diseases and we obviously have very serious diseases. So doing your research about the diseases is important.
What if I find a donor who I like, but it doesn't have the expanded genetic panel, just a list of 40 or so genes tested? Should I not bother with these donors as they're not a part of the expanded genetic panel group?
You know, I think it depends on how much genetic testing you've had done. If you've had a full expanded panel and you're a carrier for 1 or 2 things, and you're looking at the donor on our list and he hasn't had the expanded panel, that's actually a really good match for you, in the sense that as long as he has tested negative for what you're positive for, if you really like this donor, you can consider having him tested for the diseases that you're a carrier for, and make him suitable. So if you're a carrier and you're picking a donor that has not had the testing done, you have to realize that maybe it is worth it to keep looking to find someone who's a match now instead of having to wait for additional testing to be done. So it depends on how many other criteria you have that make that list longer or shorter. If you really are looking for a donor that has a very specific list of characteristics, then it may be harder to find that right match right away. I don't want you to exclude any donor initially, just because of the testing issue, but if you are trying to do a cycle immediately, then it's important to find someone who matches you now. So that would be most likely the expanded panel donors.
Christy, I've got someone asking about how long it takes to ship to the UK.
Great question. Shipping to the UK is a little bit more involved, but not too much. The clinic would have to be registered with us, and we can check into that by reaching out to our international team. We have an email that you can send any of those questions to, and that's global@fairfaxcryobank.com. We have actually a depot in Manchester, UK, so many of our UK compliant donors are already available in the UK for a quick ship. If not, we can still ship to the UK from the US within a few days. Your clinic does have to approve your shipment, and the international team can walk you through how that's done. But I always say, give yourself at least a few weeks to reach out to us before you're going to need the specimen at your clinic. That way we can walk you through the international process, make sure your clinic is registered, and have enough time to reach out to your clinic to get that approval. And again, that email, global@fairfaxcryobank.com.
And I know we have some Canadians on the phone too, and that email works for Canadians as well, if you have questions about the shipping process or anything in Canada as well.
Yes, that's fine. They can also reach out to us at that same email.
Great.
And just to keep in mind, our donor search does have different options for different countries at the top. So if you are looking at donors and you are not in the United States, it is important to see if the country that you are going to be shipping those vials to has a flag at the top, and then only be looking, click on that, and then you'll be given the donors that are already compliant for that country for shipping.
Another question for you, Christy. We're getting some questions about the cost per vial and cost for the fee to store with the cryobank.
Okay, prices are going to vary. It's going to depend on the category of the donor that you choose and the preparation type you need. So that information will be listed on the donors page on the search. In regards to storage, we have multiple options. We have anywhere from a monthly option of $40 a month. It's a flat fee per account, up to prepaid plans starting at 6 months, up to 10 years. So we have different options there. We're also running some promotions right now on storage. So if you place an order with us and put, the minimum of 1 vial into storage, we can offer you 3 months of storage for free. We also have other promotions always going. For example, if you buy 8 or more vials, we offer 2 years of free storage. So I would recommend that reach out to our CS team and we can walk you through those different options depending on what the donor actually has available, and we can also give you prices as well.
Thank you. Ben, if you plan to do IVF, can you just do the testing on 1 embryo?
Embryo testing uses an absolutely minute amount of DNA. And so when you are testing an embryo, you can do this general screen that they do for the trisomies, for the Down syndrome, the trisomy 13, 18. They can do that general screen, but if you're looking for a specific genetic disease, let's say it's cystic fibrosis, where one of you is a carrier, but we don't know the status of the other partner, it becomes very difficult. We need to know which variant each of you has, the sperm donor and the biological mother, so that we can track those specifically into the embryo, and that needs to be known before the embryo is created or before the embryo is tested. Otherwise, the known variant, which might be in one of the parents only, there's a 50% chance it's going to end up in each of the children or embryos. So you would know the presence of the carrier status, which is healthy, and that doesn't give you too much more information. So if you want to be doing embryo testing, that is a situation when both parents are carriers. Both biological parents are carriers with known genetic results. Those variants then are specifically tracked into the embryo. And if it's a very rare disease, those labs will often need months to set those tests up. It's actually quite complicated and can get very costly. The easiest way to avoid having to be in that situation is just to know the genetic testing before conception. So you can't do that 283 expanded panel on an embryo. That's just not possible.
Okay, how long do donor updates go for beyond the donation period? And will I continue to get donor updates long after I've purchased and had the baby by that particular donor?
The nice thing about the website that we are doing is that if you purchased a donor 20 years ago, that donor is still available online to be viewed. Now, he's obviously not selling vials anymore, but if you use, your donor number, 1234, you put that into search by ID, his donor page will show up. Even for donors that were sold before the internet, we have products up there that were available that we used, that we shared with clients at that time. So those pages will always be there for those donors. And the one part of his page that could potentially be updated is that summary profile and then you go to the summary profile, you'll see the update button, you'll see the box, and that will be perpetually updated as long as we're getting information from the donor. And you know, there are some donors that have been providing annual updates for 15 years. Some of them provide updates less frequently. Some of them haven't started providing updates yet. But that that will be available, and the good news, available when your children want to be able to see it. His childhood photo, an audio interview, his silhouette, all that information will stay online. We have no intention of taking it down. So even for donors that have sold out, it remains there.
If there's a clear trend among the offspring, parents are consistently reporting the same condition in their child, at what point would you attribute the condition to the donor's genetics, and what is your responsibility to report this information to all of the intended parents to use gametes from this donor? At what point is the donor removed from the database?
Well, like I said, the donor profile page will always stay there. He may be removed from sale, that we won't allow any future sales, but the information about him will stay posted. Obviously, when there's a medical report of a child with an issue, we do take into consideration how many children have been born, have other issues been reported in other children. The medical director and I will certainly sit down immediately and discuss what the risks would be to other offspring. If the risk is increased, we do make an effort to notify everyone who has ever purchased that donor, even ones that do not have a reported pregnancy, because we don't know what the status is for people. They may have an embryo ready to transfer, or vials they have in storage that they haven't used yet, or perhaps they used the donor and then went on and used a different donor. But regardless, we will notify everyone who purchased the donor by email. So keeping us updated with your current email address is really important. And then if the email is returned, I will send a letter. We also send notification to the clinic where the vial was shipped with the same medical information about what the issue is, what we established the risks to be. Most donors who do have what we call this medical restriction are being restricted for things that don't have specific genetic tests. They may be something like a heart defect, where it's contributions from both biological parents, but there's no genetic test that we can specifically do for it. But just based on that small increased risk, it actually goes from 1% in the general population for any birth to 1.5% with this one occurrence. We would still notify. So we tend to take a pretty transparent approach in making sure people know what's going on with the other children. And then, of course, it's updated in the summary profile section, in the family history section. I'll put the information in there as well. So we, we don't keep that information hidden. We do want people to understand what we know. We want you to know.
I think we have time for one last question here. I am a carrier for one type, but I didn't see it as part of your expanded genetic testing. Will I have to call to see if you guys can test for that genetic carrier on the donor, or if it is not on your expanded genetic testing, it can't be tested?
So if you know the gene for which you're a carrier and you don't see it on the drop-down option to select, then you would need to let us know which donor you were interested in and which gene you want to have tested. I would have to see if it's possible to get the donor tested. We do have numerous requests where I do have to go to laboratories other than Sema4 to do the testing, but some of those laboratories are going to require the donor to provide a blood sample, which may or may not be possible. I do need the donor to be available and accessible, still live near a collection site. So I do think that's a call and ask situation. But for instance, if you had a panel other than the Sema4 283 and you're a carrier for something we've never tested any of our donors for, then you'll have to contact us. And maybe if your first choice donor isn't available, your second or third would be. So we would definitely work with you on that. So I think sounds like we've wrapped it up for today. Be aware that promo code is going to be available through the end of the month. And if you're still looking for donors and want to be able to download all that information at no cost, definitely use that. And thank you all for being part of the webinar today. And I look forward to to hearing great things about successful outcomes from all of you. Thank you.